Watch as this provider takes a sexual history from a male patient. What do you think the doctor could have done better?
Hi, I'm Dr. B. Are you James Abbott?
Yes.
What would you like me to call you?
You can call me Jimmy.
Okay. So what brings you in today, Jimmy?
I'd like to get STD tested.
Okay. Are you having any current symptoms?
No.
When was the last time you tested for HIV?
About a year ago.
Were you tested for other STDs as well?
Yeah, I think so.
So you sleep with men?
Yeah.
What kinds of sex do you have?
Oral and anal.
Are you insertive or receptive?
What do you mean?
Are you the top or the bottom?
Oh, I do both.
And you always use condoms, right?
Well, like half the time.
Okay. And how many partners have you had in the last year?
About 50.
You said 50?
Yeah.
Okay. And where do you meet most of your partners?
Mostly at the bars, some of the phone apps.
Have you ever been diagnosed with an STD?
Yeah, but it's been a while. I think it was chlamydia.
Do you use any drugs?
I smoke cannabis sometimes.
And how about alcohol? Do you drink any alcohol?
Socially.
Do you smoke cigarettes?
No.
Do you have any medical problems? Do you take any medications? Do you have any allergies? Is there anything else you want to tell me?
I mean, I take a multivitamin.
Okay. Well, let's get these tests done. Before we do, just a couple of things I wanted to discuss with you. So you really should be using condoms all of the time. You said 50%, it should be 100%. You really always want to use them. And also, you mentioned a lot of partners. I think toning down the number of partners you have, you know, because you're at really high risk for getting an STD or HIV.
Okay.
What did the provider do that limited their ability to collect a complete sexual history? What could they have done differently? We noted they did not elaborate or offer examples when a patient was not sure of a question. They did not ask questions or elicit more details. For example, types of STD testing, condom frequency, partner status, drug use. They made assumptions about the patient's behavior. They were too technical with medical terms. They asked presumptive, closed-end questions. They were judgmental. They missed opportunities to educate and discuss HIV prevention strategies, including PrEP. Their advice was critical and unrealistic. They did not engage the patient. Here's a more comprehensive and open way of taking a sexual history.
Hey, I'm Dr. B. Are you James Abbott?
Yeah.
Is that what you'd like to be called?
You can call me Jimmy.
All right, great. What pronouns do you use?
He and him.
I use she, hers. So what brings you in today?
I like to get STD tested.
Okay. Are you having any current symptoms?
No.
So I just want to run through a few. Any fevers, weight loss, rash, sore throat, discharge, pain when you go to the bathroom, any of those things?
No.
Okay. So when was the last time you were tested for HIV, Jimmy?
About a year ago.
Were you also tested for STDs at that time?
Yeah, I think so.
Do you know what samples they took?
Well, I think they took a mouth swab and some blood and urine.
Okay. Did they do a swab of your throat or of your butt?
Oh, yes, they did.
Okay. So who are your partners?
Well, I sleep with men.
Okay. Any sex with anyone else?
No.
What types of sex do you have?
Oral and anal.
Are you top or bottom, both?
Both.
And how often do you use condoms?
Most of the time.
What percentage of the time does that mean?
I guess like 75%.
Okay. And how many partners have you had in the last year?
Around 50.
How about in the last 3 months?
Like 10.
Where do you meet most of your partners?
Mostly at the bars, sometimes on the phone apps.
Do you ask your partners about their HIV status or if they have STDs?
Yes, all the time.
Okay, good. And have you ever been diagnosed with an STD?
I think I had chlamydia.
Okay. Were you treated for that?
Yes.
And do you remember what they gave you?
They gave me some pills.
Okay, that makes sense. Have you ever engaged in sex for money, drugs, or anything else?
No.
Okay. Thanks for answering that. Speaking of drugs, do you use any?
I smoke cannabis sometimes.
Anything else?
Well, during sex, sometimes I use poppers.
And have you ever injected drugs?
No.
Do you smoke cigarettes?
No.
How about alcohol? Do you drink?
Socially.
How often?
On the weekends,
And how many drinks per night?
maybe 2 or 3.
Do you have any medical problems?
No.
Any medications that you're currently taking?
No, but I take a multivitamin.
Okay. Any allergies to any medications that you're aware of?
No.
Anything else you wanted to tell me that I didn't ask you about?
No.
And do you have any questions for me before we go further?
No, not today.
All right, great. So let's get these tests done. But before we do, I was just wondering if you'd heard of PrEP or Truvada, sometimes people call it.
Yes, I have.
That's great. Where have you heard about it from?
My friends.
Is it something that you might be interested in?
Sure, but I'd like to learn more.
Okay, we can do that.
What did the provider do to make the patient feel comfortable and allow for more open dialogue? We noted they provided examples when the patient was unsure about an answer. They followed up at times during difficult questions. They did not make assumptions or judgments. They matched the patient's language. They used open-ended questions. They opened up the dialogue to discuss HIV prevention strategies and PrEP. If there is time, you can also ask the patient about where they met their partners, if they discussed HIV/STI testing with their partners, or if they exchanged sex for goods. You should also discuss what tests you are performing.